On Robin Hood Radio today, we are welcoming in the Executive Director of SVNA. Actually, with the press release that was sent out and the information then that's been announced, Foothills VNA, I think, is the official name. But let's get this right from the guy at the top, Mike Caselas. Mike, it's still SVNA, but it's part of Foothills VNA, right?
Well, actually, Marshall, there was three agencies have come together: Salisbury Visiting Nurse, Foothills Visiting Nurse, and VNA Northwest in Bantam. And we will be having a name change that's more indicative of the location that we take care of patients. And that new name is going to be Visiting Nurse and Hospice of Litchfield County.
All right, so Visiting Nurse and Hospice of Litchfield County. And anybody that knows me knows that I became acquainted with Salisbury Visiting Nurse Association many years ago when I was the caregiver for my mother. And the last 3 or 4 years of her life, I depended heavily on the advice from Salisbury Visiting Nurse Association. And even though I've been in broadcasting and I was always aware of lots of different things that were available for seniors, it wasn't until really SVNA opened up my eyes to a lot of things, and even for an end-of-life experience when we brought hospice in. So it's an important organization here and throughout Litchfield County and our entire area. Let's speak about your background a little bit, Mike. Have you always been involved in healthcare?
I have. I started my career out of school at Charlotte Hungerford Hospital, primarily in financial and administrative capacities, and spent 11 years there. And I've been in the home care industry for about 20 years now. So my whole career has been in the healthcare field.
You know, it's interesting to hear you say that because I've spoken to hospital administrators, and a lot of hospital administrators, so they have that medical background, before they become CEOs of hospitals, they really have spent most of their career in the other side of the field. Do you think that knowing the other side of the field, more of the numbers and more of the business side, helps you out in a position like this?
I do think so. I think even more so as of recently. Healthcare is a business, and we have to run it as such. And I do rely on our clinical leaders for some of the advice that is not part of my background. So we have a clinical director, and we have a therapy director, and they handle a lot of the areas that are non-business and administrative related.
All right. Well, let's talk a little bit about this merger and the joining of forces, because I think even though people like, especially out here in the boondocks, people like to keep something that of their own as their own. But I think as we go further along and we mature and we go into situations where there's different overlapping agencies that overlap, that this is an area that can only really help in the coverage, as the fact that obviously the more people you have, the better coverage you can have, and the more effective you can pinpoint coverage.
That's exactly true. Very, very good and very true statement, Marshall. The reason why the three agencies got together is because we realized they were duplicating a lot of services in the area. We were covering each other's towns. We were sending nurses up to the Sharon and Salisbury area, and Salisbury was sending nurses and therapists to other parts of the county. So it made for inefficiencies. So together we will be able to better serve the patients and the residents of Litchfield County and Northwest Connecticut. And we'll be able to do that more efficiently, and we'll be able to save things in like travel time and some back office duties and insurances and dues and things like that. But the average resident or the patient that's in any of the towns that we cover won't see much of a difference. Salisbury will still be there, and we'll have staff there, and the Bantam office in Northwest and Foothills and the Winsted office will continue to to have staff and be able to cover those areas effectively, and actually more effectively than we did in the past, because we'll have access to more staff than we did separately.
We're speaking with Mike Caselas, who is the SVNA Executive Director. I heard a lot of people have talked about the pandemic, and I think, and correct me if I'm wrong, the pandemic probably pointed out a lot of reasons why this move was good, and maybe the move came quicker because of the pandemic. Would you tend to agree with that?
We've been talking about this for quite some time, but certainly the pandemic might have heightened things a little bit, as far as everything that's going on. But it's something that healthcare has been seeing recently. You can see in the different areas, hospitals have been merging. Other home care agencies have been merging. So again, it's just a sign of the times in which reimbursements are shrinking and expenses are continuing to increase. So it was the right time and the right thing to do for all three agencies. Certainly, the pandemic was at the timing was able to be an impetus as well.
Now, as operating as you do, dealing with a whole range of different clients, mostly, I won't say all, but probably predominantly senior. But I know I use the facilities of SVNA. I'm a senior now, but 5 or 6 years ago when I used it, I wasn't a senior. And I think one of the great things that all the organizations that are now under one roof is that it's always been my interpretation that people heal better at home or closer to home. And also people who are home that are elderly that don't have as many visits. I think that your visits there help on a multitude of levels.
That's true. I always say, and I'm an advocate of home care, that care in the home is the best place to be. Nobody wants to be in a facility, home in their own surroundings and with their own family and friends around is certainly the more effective and efficient way to take care of people. And again, that's our job. And in a nutshell, our job is to keep people independent in their homes and prevent them from having to go to a facility for care.
Yeah, it's so important. And what you talk about, the reimbursement rates, that's another thing that I think that an organization like Salisbury VNA and all the other organizations, you really know up front when you get involved with, like I can only speak for my involvement with Salisbury Visiting Nurse Association, but you know all the economic ins and outs, the advantages and the disadvantages, and you're basically providing a service that when you provide that service, I can tell you right now, your service is so much more inexpensive than if you were to go to an actual rehab center from a hospital, that when you add up the local touch and the fact that the cost is much less, really makes what you do even more important.
That's true. Home care is also one of the most cost-effective modes of care that patients can have. I'll give you an example. An average 60-day episode of care as a home care agency, that would cost about $3,000. And most of that is reimbursed 100% by Medicare and the Medicare managed care players and commercial insurances. Pretty much it's mostly covered. Sometimes we have some patients might have a copay or a deductible or things like that, but primarily we find that it is cost effective, and comparing it to a nursing home stay or a stay in a hospital, it's certainly much more cost effective than it would be in another type of facility.
So now, are you enjoying what you're doing now as compared to being on the financial end? Because you're not only on the financial end here, you're also finally get a chance to see the benefits of what the financial end provides to these organizations.
That's right. Finance is my background, but we get involved with a lot of things in a in smaller type of agencies. So, we want to make sure that the patients are cared for effectively, and we have the resources in order to do that. So, again, we're all mission-based agencies, and we have a nonprofit mission, and that's to take care of everybody, regardless of their pay source or their ability to pay, as long as that we can continue to afford that. So I think that was important, and it was a main reason for the three agencies to get together with like types of agencies. We're around, Salisbury around 115 years, Foothills around almost 100 years, as well as Northwest. So that is a very true statement.
We're speaking once again with Mike Caselas, who's the SVNA Executive Director. Now, are people going to be able to use the same numbers and websites, or is that all going to evolve over time as well?
It will evolve. Right now we have each organization has their own website, but we're in the process of updating those websites. That'll happen in the near future, and we'll be able to add content and add things that are related to all three organizations as they come together. So there will be updates and some changes to those websites.
Now, also, I think another thing that you help provide is information to families, and I mean that's what my brother and I found so helpful 8 or 9 years ago at the end of our mother's life. First of all, SVNA had people that came in to see my mother when I couldn't see her, and they became, well, she knew them, first of all, for being in the community, but second of all, they became visitors that around, when you look at a 24-hour day, my mother basically had people coming and going every couple of hours. It's so important, and I say this out in this area, because there is not much rural transportation for people that are elderly, and I think what your organization does, and what it will continue to do and get better at doing, is making people feel more comfortable, not only the person that you're visiting, which might be somebody's grandparent or parent, but also the caregivers. I mean, what you do provides a lot of relief to caregivers. That's true.
You said you touched upon the information, and we find all the time that the patients or the families or the caregivers just don't know where to go or have the information in order to properly take care of, mom or dad or whoever that they're taking care for. So our staff, not only our nurses and therapists, but also our social workers, are a wealth of information when it comes to what's available to the patient and the families, not only in the community, but also throughout the state, what the state has to offer, and different options that they may have in order to, get services and be able to remain independent in their homes for as long as possible.
Well, once again, the merger of three local healthcare agencies under one roof will benefit everybody in the long run, and especially now. I think what we can point out since the pandemic and moving onward is how important having these organizations out here are to family members and the people themselves. When you look ahead now, I know it's really hard in the healthcare industry to look ahead. When you look ahead, what do you see in front of you over the course of the next, let's say, 6 to 12 months?
Well, we think that the biggest challenge that we have in home care and in this area in general is the high demand for qualified caregivers, not only nurses but therapists, CNAs, things like that. There's just so many nurses and therapists and those type of caregiving people that live in the area that want to do home care. So the biggest challenge that we're going to face in the next 6 to 12 months, as we continue to grow, because the pandemic has also certainly made it so that people are more focused on staying home and reducing that chance for infection and going to facilities. So we believe that our business is going to continue to grow and become more prevalent. But our biggest challenge is going to be able to recruit and retain qualified staff to take care of all the patients throughout the county that's going to need our care.
Well, Mike, keep us updated and informed like you always have in the past, and good luck in your position, and good luck, and a thank you, well, not only for me in advance, but thank you for the services that I know I've used over the years with Visiting Nurse. I think it's just, it is the future of medicine, believe it or not, in my opinion. So keep up the great work.
Thanks, Marshall, and thanks for your time today, and I look forward to talking to you again in the future.